Hello guys, welcome once again to the DocTab. This is Dr. S.K Ratemo, and today we are going to talk about a condition that can be fatal among the pediatric population, and it is known as gastroenteritis. Gastroenteritis, this is an infection that is affecting the gut or the system that usually digests your meal and absorb for you to get nutrients. Bacterial infections and viral infections are among the top in the list as causes of gastroenteritis in the pediatric population. So, how will you know your child is suffering from gastroenteritis? The two most common symptoms of gastroenteritis is diarrhea and vomiting. As a parent, you must be monitoring your child, especially if it's the very young. The number of diapers that you will be changing in a day will be increased, and when you look at the stool, it might appear to be mucoid and watery in nature. And sometimes you might find that there are some blood stains, which means this child has been infected by a bug that is actually burrowing the gut and causing bleeding. The other symptom is vomiting. Your child may not be able to put anything down, and even if they feed, they will be vomiting. So several episodes of vomiting and other things like stomach ache may or may not be there. So when you have brought your child to the hospital, we have taken the history. What are we going to do next? Now, of course, we need to know what is causing the gastroenteritis. Is it a viral infection? Is it a bacterial infection? Because the management is very different. Now, if we do some tests on the stool of your child and we discover that the cause of the gastroenteritis is due to viral infection, then we will not do much. And when we tell you that, there's no need to panic, because most viral infections are self-limiting, and by that we mean that they will just clear on their own. So if we discover that the gastroenteritis is due to viral infection, all we will do is just to replenish the fluids that the baby is losing and optimize oral intake and observe for about 5 days, and your child will be okay. But if we find that the infection is due to bacterial infections or other parasites like amoeba, then we will administer some antibiotics like metronidazole to clear out the infection. But at the same time, we will also replenish the fluids that the child is losing. But remember, the take-home message for gastroenteritis is maintain cleanliness. Cleanliness in how you are preparing your food, the source of water for food preparation and drinking, and also teach your child to always wash their hands before eating fruits or any other food. This has been Dr. S.K Ratemo, and I'm happy to have met you in this video.